Good afternoon, everyone. My name is Dr. Ashkan Lashkari, MOASC president, and today we'll be featuring Dr. Elizabeth Budde as part of our spotlight on our clinical researcher of the month. Dr. Budde is an associate professor at City of Hope in the Division of Lymphoma, Department of Hematology and Hematopoietic Cell Transplantation. We're delighted to have Dr. Budde here. Thank you so much for joining us.
Thank you for having me. This is a great honor to be here, and also thank you for featuring me and my research. It's such a great feeling to to have this opportunity and be recognized.
Greatly appreciate that you're here. As part of our as part of this brief meeting, what we'll do is just ask you two questions, and the first will be, what are you most interested and excited about in your area of research in lymphoma? And then secondly, what trials or clinical trials are you actively participating, leading to better understand those interests? So I will let you go ahead and share with us. So what are some areas of interest that you're most keen on in lymphoma?
Yeah, so in lymphoma and also extending to leukemia, my key interest has always been developing or testing immunotherapeutics as a treatment options for patients. So so I'm super excited about the recent approval of bispecific antibodies, for lymphoma. So last year, December 22nd, mosunetuzumab, an anti-CD20, anti-CD3 bispecific T-cell engager, was approved for patients with relapsed refractory follicular lymphoma after 2 prior lines of treatment. So that's the first for lymphoma, but it's not the only one. So going forward, there will be 2 additional bispecific antibodies this year, likely will be approved for patients with aggressive B-cell lymphoma. So the more and more similar products, it's on the going through the regulatory pathway to provide more benefit for patients. And these are pure immunotherapeutics, it's unlike chemotherapies. So these immunotherapeutics really utilize the patient's own immune system, activate them, redirect and educate them to recognize patients' lymphoma or leukemia, or multiple myeloma actually. So it's very exciting to see immunotherapy is really now becoming a main treatment modality.
Absolutely, yeah. That approval came out, I think, at the end of the last year, and certainly, as you mentioned, I think we're going to see a lot more about bispecific T-cell therapies becoming more prominent, both in lymphomas, myelomas, and perhaps even in solid tumors shortly. Perhaps you can discuss with us some trials that you're leading that you're most excited about, and perhaps share with our audience how we may be able to refer our patients into those trials.
Yeah. So thank you for giving me this time to really talk about bispecific center clinical trials. So at City of Hope, we are really the leading site for development of mosunetuzumab. So we actually put on more than 100 patients on the first trial using mosunetuzumab for patients with follicular lymphoma, and we play a pivotal role for this regulatory approval. And now one of the things I'm very excited about is we also participating and putting a lot of patients on the trial that we're testing mosunetuzumab in a different formulary. So instead of giving intravenously, that's the approved version. Now we're testing mosunetuzumab subcutaneous version, which is a lot more convenient and looks like promisingly there's less side effect. And I'm hoping that the trial just completed it. We're putting the data together. So that's still in a follicular lymphoma setting. And there are more clinical trials that we about to or is opening is combining mosunetuzumab with other immunotherapeutic. For example, mosunetuzumab together with polatuzumab, which is antibody drug conjugate, also targets the malignant lymphoma cells. So these two immunotherapeutics adding together, led to at least around 50% of complete remission rate in patients, regardless they have prior CAR T-cell therapies or not. And this trial now is going into a phase 3 study. So we had that trial open at City of Hope. And meanwhile, we're also testing mosunetuzumab in clinical trial setting in combination with Loncastuximab, which is a CD19 antibody drug conjugate. And we're testing a different bispecific antibody, glofitamab, in combination with a CD19 4-1BB ligand. So utilizing the concept, T-cell works best when it has two signals. One is from the CD3 targeting, the other one is from the co-stimulatory domain, such as 4-1BB or CD28. So we have a list of multiple bispecific antibodies for patients with either indolent lymphoma or aggressive lymphoma. And another one I want to highlight is also not just testing this in the setting of relapsed refractory disease, where you have a study, frontline setting, testing mosunetuzumab given to patients newly diagnosed follicular lymphoma, or in patients who had diffuse large B-cell lymphoma, aggressive B-cell lymphoma, but patient not in a good shape to receive chemotherapy. So there's preclinical data and the initial clinical data to demonstrate as a single agent, mosunetuzumab can lead to around 65% overall response rate in frontline setting for aggressive lymphoma. So the trial we now is open right now is really trying to put out more patients, to collect more data, and also as a way to offer this drug to patients who are not chemo eligible or people who are advanced age and doesn't want to go through chemo, go through the potential side effects. So very exciting about all these potential options for patients.
That is fantastic. Thank you so much for sharing this with us. I know that our patients with lymphoma have now a significant number of options as a result of these new cellular therapies that are becoming available, and we certainly appreciate your hard work in help making mosunetuzumab available. I know it was your hard work and you leading that trial that helped get the study, that helped get the cellular therapy, the bispecific antibody approved. And I think that we look forward to hearing more about the things that you just described, the trials that you described today. What we'll do is we'll provide a highlight or an attachment to these trials so that our audience will be able to learn more about them and be able to potentially refer patients to your center and others nearby if there are others that may be participating in it. Thank you so much for joining us.
Thank you for having me.